A partnership with the BC Coroner Service was established in 2012 as a result of an incident that happened around an infant death in my family, actually. And what had happened with that is that our family had experienced a very traumatic set of circumstances in relation to the actions of the coroner's service and the autopsy of my niece, which would compromise the laws and traditions of Slyman people.
We had a protocol in place for many years. When infants died unexpectedly, a full autopsy was ordered, and that routinely included retention of the organs for a period of time so they could be examined in a more careful state. And that retention was anywhere from 2 to 3 weeks. The Memorandum of Understanding between the First Nations Health Authority and the Coroner Service came about as a result of our discussions to resolve the infant death autopsy conflict that we had. And that really set the stage for our work moving forward.
The ability to grieve in a culturally meaningful way has a lot of strength and a lot of weight behind it. I have a unique set of skills which is able to accommodate the First Nations Health Authority's request to examine the brain at the same time as I'm doing the rest of the case. With the infants, it's a challenge because their brains are not as well formed as an adult brain. And it is easier to examine them after you've had a month of fixation in a substance that will stiffen the tissue. Just because it's easier to examine a brain after a month doesn't mean that it should be done on a community that's needing to have a ceremony that's going to be complete from the time of death in a 4-day window. And I'm willing to do that.
Knowing that there's now a relationship between First Nations Health and the BC Coroners, having that connection, because one of our first lines that we call is First Nations Health when we need support services here in the community, so that we know that the connection is there and we know that we can call on them for support or whatever is needed in the community.
What we've learned in working with the First Nations Health Authority is a real need to respect the culture and the spiritual needs, to ensure that at the end of an investigation they go away with answers, but they're also feeling respected and that their individual spiritual and cultural needs have been met.
The partnership has changed the relationship with the coroner service in many ways. The coroners have gone as far as welcoming First Nations people to be coroners. Incorporating cultural safety within the coroner's service by having First Nations coroners has been an amazing opportunity to really ensure we can enhance the efforts in cultural safety and humility within the coroner service. We started it with a very narrow focus, but a recognition that what we were talking about was the need for the coroner service to actually learn humility, and that's what they did.